Meeting is called to order, and we have minutes from the last meeting. I would appreciate a motion to approve the minutes.
I make a motion to approve the minutes, but I think there needs to be a spell check. There was some, I think it was CDC was not written correctly. It might have been written as IDC. So I make a motion to accept the minutes with the caveat that there just be a spell check.
Second.
All in favor?
All right.
Aye. Thanks, Barbara. That's good. You're always good at. Barbara's our official minute person.
Yeah.
You go on.
Okay. I don't see any public members here tonight, but let the record so note that there are no public comment. And then now we get to meet Emily. Emily, welcome.
Hello. So Emily just joined the department as our newest health officer, and I would allow her to introduce herself, give a little bit of a background, and take any questions from the board.
Yeah, hi everybody. It's nice to meet you all. So just a little bit about me. In 2017, I graduated from Roger Williams University with a double major in biology and public health. And then for the past year, I have been working part-time as a health agent. And now I'm new to Watertown, and it's been lovely so far.
It's great. Were you half-time or part-time, whatever?
Yeah, I was part-time in a town called Douglas.
That's near Worcester, right?
Yes.
Right. Yeah. And do you live in Watertown or near?
Nope. Currently, I live in Grafton, but I'm looking to move closer. So.
That's a good bit of driving.
Yeah, it hasn't been too bad so far, but maybe when schools go back.
Yeah.
She has an interesting tidbit to share for you about the town of Grafton, where she sat on a board.
Oh no, I don't remember what it was.
Which community were you on the Board of Health?
In Douglas.
Douglas.
Yeah.
That's great. Fantastic. Were there any particular health issues that came up that you remember?
Yeah, we had a lot actually in the very beginning. I think like the first meeting I was a part of, there was actually a hearing about bed bugs in an apartment building.
I'm sorry, about
bed bugs.
Oh, we have not yet had bed bugs here, but we've had other infestations.
Mostly rats.
Yep. Yep, not too many rats, but that was a very interesting meeting. And some other disputes too in Douglas. The department also runs the the transfer station. So we had like a dispute also between workers and some very interesting things in the beginning, but now it's been a lot about COVID.
Yeah. Well, that's great. It's good that you've had that experience, and we really welcome you to the department. And we hope we'll see you once in a while at meetings like this.
Yeah, absolutely. Thank you so much.
So, Larry, how are you dividing up these days the duties between the two health officers?
Right now, as you know, I have two very young health officers who are very new in the profession. Deanna has a little more experience with us, and Emily has experience in housing. Right now, where Deanna is doing some of the work independently, Emily's in the process of finishing up a lot of trainings that she's required to accomplish. And then we will start her out slowly, independently on going out and doing some of the housing complaints. But we need to get her trained in food and other things too. So and we're also sending her out in the field with Raj or Deanna as the opportunity arises.
So we might cover this in the update, but since you are mentioning duties, just wonder what's happening in terms of restaurant inspections given this weird timing?
We are not doing full restaurant inspections. We're responding to complaints, and we are doing odd site visits, but we have completed some of them. But given the circumstances at the moment, we are engaged in a lot of other issues. So like many other communities, restaurant inspections have taken a back seat.
All right.
Routine restaurant inspections, that is.
Have we lost many restaurants?
Well, the latest, we have lost a couple. The latest is Stelina, who announced earlier this week that they're closing. And Emily was saying today they're having a sale on their stuff. So it's sad.
Just because it's one of the restaurants that has a fair amount of outside seating. And interesting that they weren't able to make it work.
Right. But the challenge you're still facing with them is for a higher end restaurant, not only are you losing sales, but a lot of the staff in many restaurants are choosing to go elsewhere and engage in other things because when COVID hit, they were all out of jobs and they're all day-to-day. That industry is a day-to-day industry. While you will have staff, but they're unable really to maintain it and staff look elsewhere.
Rich, I think, high-end restaurants like that have to look at what's going to happen in the winter. It'd be hard to have that outdoor seating. And volume-wise, relative what they could squeeze inside, their outside was not going to keep them alive.
Yeah, even with outdoor seating, they still had to maintain the 6 feet separations as they do indoors.
Yeah.
So it has.
My feeling is there's no data that I know of, but I think high-end dining is less amenable to takeout.
Exactly.
There's the whole experience of being there and having it fresh to your table and not packaged up, so you do it at home. I think
it can be done. I don't know if you've been to Craigie on Main in Cambridge, which is a high-end restaurant, and they're doing a decent job of high-end cooking that you pick up.
He's still there, huh? I didn't know he was still open.
Still there, yeah. I mean, he's having to be really creative. So he has different specials on different nights, but they're still doing some pretty nice stuff. But they are struggling still, and they're really working hard to keep their head above water.
Yeah.
Yeah, that's why we're working with all our establishments so that, we know it's a struggle for them. And as long as they're safe,
it's hard to schedule. I mean, these restaurants that had, they had a certain number of seats through reservations that were all filled. And with takeout, it's pretty hard to schedule that ahead of time. So it's unreliable. Okay. So, Larry, what kind of calls are you getting? And other than Will having to work on the COVID, what other kinds of issues are coming up?
Are you talking about regular calls?
Yeah. I mean, you said we're busy with the health officers are busy with other kinds of matters other than the restaurants.
We're getting a lot of rat complaints, trash complaints, where there's a huge push on construction now. So ensuring that sites are properly prepared There are some food complaints that we're getting. So, it's more around the establishments and them not adhering to the requirements that have been placed on them for COVID, especially around face coverings and capacities. One of the latest we had last week, and we had to go out and have some discussions with them, is one of the diners. I got an email over the weekend, and the complainant complained about overcapacity. However, the pictures that he showed us showed that they were well prepared, but there was also a complaint about the kitchen staff not wearing face coverings adequately. And that is one that keeps coming up.
So how do you deal with that?
It all depends on whether or not it's a first violation or a second violation, because there's a specific process that's been laid out by the Department of Public Health. So it's a 4-step process. First, you have to give them a verbal warning, give them a written warning, then you can issue them a ticket, and then if they still fail, then you can take them to court.
But you can't shut them down?
If we find significant violations, especially around food establishments that places the public at risk, we will take actions under the food code and not follow any the protocols that the state has imposed on us. Because our approach is going to be risk-based, and we will make our judgments based on risk and our regulatory authority.
Right. But it's interesting. That's very interesting, because our risk has always been based on the safety of food, not the safety of an outside agent.
Yes, that is correct. But there are specific protocols that they have dumped on us, so we have to follow their protocols on that. The unfortunate thing is a lot of what they have placed on us is guidance with an expectation to enforce the guidance with no regulatory authority to do so. The other challenge we're also facing is with schools reopening. I am being taken up with many people submitting comments and asking for information around school opening. Again, the Department of Elementary and Secondary Education has made some decisions that significantly conflicts with the policies that were put out by the Department of Public Health. I know DPH and DESE is having conversations now. We are in discussions with our school department around how they would approach reopening. And I am assured, and I'm very heartened by the school superintendent's approach to the whole reopening process. The fortunate thing is many of it was not mandated by DESE, but these are guidelines, and the school departments and school committees then can choose to follow, although there are minimum requirements. For example, if you're in a community that is, and you've all seen the maps that the Department of Public Health is putting out with the 4 levels. So if you're in a white community, their expectation is that you would have in-school training. If you're in a yellow or green community, which is moderate levels, then you will have a hybrid model. And if you're in the red, it will be all online, sorry.
What are we?
We are most likely going to be going into a hybrid model.
But are we in the yellow zone?
We're in the yellow right now. I'm sorry, we're in green. And because we had a few cases, of course, lo and behold, it's related to people going out of town, attending family events, and not adequately observing social distancing or face covering wearing, and they came down with it. And we have had some of those challenges that happened. Our caseload went up. We're starting to see a downward trend right now, and we hope it continues so we can get back into the white.
Are these people who went out of state, or was it in state and the social gatherings were too large?
State.
In state.
In state.
Okay.
So you're saying that right now we're moving forward with a hybrid model based upon the current level of Watertown, which could change before the school year?
Anything can change before the school year because
Right.
while that is the plans, and it's dependent. The school superintendent had to develop 3 different models, and we're at a stage where it, based on the guidance, it says hybrid. That may change. We may go back to white, and in the best interest of public health, they may still decide to maintain a hybrid model, but the decisions are going to be made by the school superintendent and the school department.
Right.
Right.
We will review, and if we believe that there's significant risk for the spread of COVID-19, we will make recommendations to the school department and I will ask you to take the appropriate action.
And right now, they're planning on being remote for like 3 or 4 weeks and then going hybrid.
I believe that is the current plan.
Yeah.
And I don't know if you saw that today too. The DPH has decided to mandate the flu vaccine for all schools, including higher ed. So I don't know if Will is ready for a much higher pediatric population for the flu clinics this year.
The school department will be doing their vaccinations in-house for the school population.
Oh.
And that is something that we're looking at. We cannot do the school population. And I've had the discussions with the superintendent, and they're preparing to do their vaccinations in-house.
Do we know when the vaccine will be available?
It's available now, maybe not in Watertown, but it's available commercially.
It is available commercially. I don't know when we will get our allotment. We have 2 sets of vaccines that we get. First is our personal purchases, which we usually get in early September. Then we have the state allotment, which comes a little later. So the state allotment is for people under 19 and people who have no insurance or underinsured. That is the current guidance. I don't know if it will change, if DPH will say vaccinate everyone. In years past, we have been given the okay to vaccinate as the older over 65 populations and the under 19 population, as well as later down in the season, they said vaccinate everyone. So, the situation is really a dynamic one. So it's always subject to change. And the information I have and the information I will provide to you is only as good as the time you're getting it.
And what are the plans to publicize the availability and the need for flu vaccination, especially this year?
Yes, there are plans in train. Will and I meet routinely and discuss our plans. We're in the process of discussing the actual model of the clinics, whether or not the COVID is going to prevent us from having indoor clinics, given the restrictions on the number of people who can be indoors. That is restricted to 25 right now in a given location. So whether or not it would be more appropriate to have a drive-through clinic or an outdoor clinic. So we're working on a couple of different models and looking at different sites to see what is the best approach to it.
So you're maybe thinking about this at my university. We're using a large tent. We're arranged for a large tent, and we'll be doing the clinics under the tent outdoors.
Yeah, we have a couple tents that we just purchased a tent, and we have it's the 10 by 10 tents. You're talking more like a marquee tent.
Yeah, it looks like this tent. It's got to be like 40 feet by 100 feet or something. It's
yeah,
huge.
a marquee. So we are considering every alternative that is available to us. Right now, I think the drive-through is probably the most appropriate way to do it.
And then what would be done for people who don't have cars?
We are going to be going out to the homebound. We are going to be going out to the seniors, especially. So we do vaccinate all our senior locations, and we will be making adjustments. Now remember that for vaccinations, your health department is not the only game in town. In fact, a few years ago, after H1N1, every pharmacy was offering the vaccines, and they offer the vaccines very early. So I do not anticipate there will be any shortage of vaccines or any shortage of sites to get vaccinated.
Helpful, thank you.
Yeah.
All right, so on COVID, currently we have 467 cases, 24 fatal, 436 have recovered, and only 7 active cases at the moment. We had the addition of 1 fatal case, but it is not a current fatal. It is a fatal from back in May, where the person had moved and then it shifted from a couple of towns, and they finally identified the person was from Watertown, so they gave it to. So it's not a new case, it's really old, but they finally figured it out.
So the town that counts is the town that originated where the person developed the disease in the first place?
No, it's always your town of residence.
So if you got COVID in Watertown and you moved to Belmont, you would then become part of Belmont statistics?
If at the day you contracted the illness, you were a resident of Belmont, Belmont will get your
Okay, so it's based on where you lived when you contracted. And then if
yes,
again, it's still in that example would be Belmont.
that is correct.
Okay.
Typically, I think this is right, Larry. If you're diagnosed and then you move the next day, the local board of health will notify the board of health in the to continue the monitoring.
That is correct. We will. So if the person was diagnosed and the date of diagnosis, they were living in Watertown, the case would count for us. Then a week later, they moved to Belmont. We will transfer the case to Belmont and ask the public health nurse in Belmont to follow up. Sometimes we may choose to follow up with the person, but typically we would just transfer it out.
Larry, does Will have all the appropriate PPE he needs?
For him, yes.
What do you say for him?
Well, we have enough to meet our needs for our clinic, for the public health nurse, and for the health department. What the town has been doing is we've been purchasing, and the purchasing agent has been purchasing a lot of PPE and sanitizers, etc., for use by the departments. And we, on the other hand, we have been purchasing for use exclusively by the health department. Because in the early stages of COVID, we were also utilizing old stock to provide to the departments. It is my understanding also, and the fire chief is currently on vacation, so when he comes back next week, I will hear from him that there's a huge shipment of PPE and other COVID-related materials that was going to be distributed to the towns through MEMA.
All right, let me ask you something. Now the guidelines are 25 people in any indoor space, is that correct?
That is correct.
How does that affect the supermarket, Russo's? I just don't see that happening.
That is for performance venues. They have not insisted on that for places like supermarkets and food shops, etc.
Okay, all right.
Because
That's why Instacart is doing a great business.
Yeah.
And I can tell you, there's some significant questions we're asking. Many of us are not happy with the responses we're getting. For example, the conflicts between what the Department of Public Health is putting out as guidance and what DESI is putting out as their guidance. So they're working that out. Plus, some of the decisions are being made by other departments and they have the input. It's being pushed on us to enforce, and public health is not at the table with those guidance and information. I've asked a question about the sale of food at a cinema. So cinemas, indoor seating, indoor cinemas cannot have a concession stand open, but a restaurant can be open for indoor seating. You can go to a drive-in theater and walk to a concession stand that is essentially in a building and buy your stuff, go back to your car, but you can't stand at a concession stand in a building, buy a box of chips, a bag of chips and a Coke, and go into the cinema where they're all socially distanced and meeting the 25 people per cinema capacity. And it makes absolutely no sense. So there's several challenges where I don't know if people are thinking things through. I have asked for the public health rationale, and many of my colleagues who are public health directors have asked the same, and one of the answers we got was because it's in the guidance, and that is not good enough for us. So there is significant displeasure with many of the answers, and sometimes when we have calls twice a week, a challenging question is asked and it's met with silence. And after about half a minute, we look into it and we never get a response because no one has an answer, especially around the challenging ones where you don't understand what the rationale is.
So a movie.
I am not defending any rationale. If I don't understand it, I am not defending it. And I will take action as is appropriate for my community.
So Larry, did the movie house open with 25 people? It can't survive opening, can it?
We're going out there, it's either this Thursday or next Thursday for a site visit. I believe it's next Thursday because they want to open. I believe there are 4 or 5 screens in there. So that's 100 people. And if they show one show, they can make up for it. But
Oh,
it
I
is
see.
their desire to at least get going. So,
And to your original point, we all know they make all their money at the concession stand, not necessarily the admissions.
right.
And if they're not allowed to open those concession stands, it makes it doubly hard for them to pay their rent to the Arsenal Yards or whatever that is.
Exactly.
And what about the rest of the Arsenal Yards? Are they all like open and functioning?
Everyone who has a permit is open and functioning. Frank Pepe's is open this week.
I do
We did
wonder
a soft opening on Monday.
what kind of business they're doing, because I was driving through there the other day after I went to Harvard Vanguard. You know, I saw Ben and Jerry's and some other places that were open, but the whole area feels like a construction zone.
Well, that is exactly it. They're doing construction and they're phasing in people. You have COVID happening at the same time, so a lot of them they're doing takeout business. Frank Pepe's is all takeout. So you go online, you order your pizza. When you they will tell you when it'll be ready. When you get there, you text them, I'm outside, they bring it out for you. So you're not going to see a lot of people parked up.
Yeah.
It's the same. The City Works is having people in their dining rooms, but again, it's really restricted on the amount of people there. So they're doing a lot of their business on takeouts as well. Same thing with Ben and Jerry's. You come, you get an ice cream, and you go. But running a business while you still have major construction going on around you is not helpful for your business. And
That's what I was thinking. And overlain with COVID and the restrictions, it's a
Right.
tough time.
But on the other hand, people are tired of being home eating their own food. So
Yeah.
Now, Larry, what about are there still plans to put in a biolab at the yard?
those plans are still moving ahead.
okay, I think we're moving through our agenda. Anything else around COVID-19?
Just that we have the map. There is some changes in our building where next week early voting starts, I believe, or the week after. So once early voting starts, we are no longer going to be bringing people in through the lower hearing room. Everyone is going to be accessing services through a window on the library side of Town Hall. And if people have appointments, they're going to be asked to wait and come into the building on that side so that early voting is not, there's no conflict between people coming to early vote and do business at Town Hall.
So is there a door in that
Yes.
hall in the basement level? Is there now a door to separate or something blocking that?
No, what you will do, there's a window. If you come, say you come to pay a bill, you go to that window and pay a bill. If you have something to drop off, you drop it off at that window. And it will be put in the boxes for the individual departments.
So this is on the library side of the building?
Yes.
So they put in a new window for?
No, we're just going to be opening up a window that's there.
Oh, okay. And so is that how you will drop, if you fill your ballot out at home and you want to drop it off, is that where
No.
it would happen?
you come down to the other side, you have to access the clerk side. That's where early voting is going to take place. So if you want to drop off your ballot, then you have to come in on the Sultan Stall Park side.
Okay.
But so if they have erected some kind of barrier so you can't walk through from one end side to the other?
No, no. Excuse me a minute.
No, you're talking about the state ballot, or is that more of a local?
No.
The primary ballot and then later the federal ballot.
Right.
Right.
So, but they can, even if you've received a mail-in ballot, you can deliver it in person, since some people aren't going to trust the post office these days.
Okay, that makes sense.
It's a minor configuration, but we have the system down. It's going to affect us who work in town hall more than it's going to affect the public. Because when you come to town hall now to vote, you will be told to go over to that side, and you come into the door that you normally access the building, go to the clerk's office, and then from there go into the lower hearing room, vote, and then exit through the lower hearing room door.
Are they going to have some way of keeping too many people in there?
They have to meet, well, the room is self-limiting. So they have to figure out setting up a system of lines on the outside.
And the drop-off ballots, will that be in the room where the town clerk is now?
Yes.
Okay.
It's too bad there isn't, because I think there are going to be a lot of people bringing the mail-in ballots, which you don't have to record anyway. It's too bad there isn't some kind of mail drop.
I can't go to that same window that they're talking about?
I believe they can.
Yeah, just have an extra bin.
Just so you're aware, a lot of the processes around that are still being developed, and the information I have is what is current right now. So tomorrow, John, the town clerk, may be telling us, okay, this is the way I need it done. Just so you're aware, none of the restrictions around meeting sizes and all of that applies to elections. So your voting station, your polling station, is only restricted by capacity, its own capacity, not any other capacity that is set by the governor or other departments around COVID.
So will the town be putting out information on the website? Because now there's multiple options. You can drop off the ballot that you were mailed. You can do in-person voting. You can do early voting. So will the town be putting something out on the website that?
I believe the town clerk will.
That just brought to mind the, that box by the curb where you can drop off any town paperwork from your window.
Actually, that is not for any town paperwork. While we do get stuff, that is actually a drop box for the treasurers, not
I have to go look at the signage again. I thought it said any town.
No, it's treasurers.
Maybe it could be made available for any town business.
There should be a box for ballots so that people don't have to be uncomfortable coming into an indoor space.
Right. Again, all your comments around these things are not within my purview.
Right.
It is stuff that the town clerk is responsible for. And as you, of all people, will be aware, I tend to stay in my lane,
Yeah.
not
We
involved
like
with myself,
to share with you, Lori.
because I have more than enough to do
Yeah.
with what I have to do than to worry about how another
But,
department is going
Larry,
to manage
I just
things.
would point out that these are all Watertown residents that are voting. And
Mhm.
if there's a bad spreader in that space, your department's going to end up suffering
Oh,
by.
absolutely. And we're working on the voting process details with the clerk.
Yeah. Good.
But the semantics around how the process is going to work and those things, that is not in my bailiwick.
Right. But the
But
more,
certainly,
the more you can make it so that people have to maintain social distancing, the better your life will be as well.
But that is a given, and I've already had that discussion with the clerk.
yeah, as part of all of your guidance to these other departments, something as simple as an exterior drop-off box, well in the realm of, safe distancing and minimizing risk.
I hear what you're saying.
So I mailed my ballot this morning for the primary.
So that gives you more than 2 weeks. It should get there.
It should get there. I guess the postmaster decided to reverse all his shenanigans. Okay, item number 6. Anything particular else about the department?
Well, the big one is we had Emily, and she keeps coming back every day. So
That's
there's something that we do. She keeps enjoying and coming back to the department. It is really a joy to have her in the department. They're all really engaged, and I thought I was a repository of useless information, and I'm sharing it with them daily, and they seem to enjoy what I tell them.
Yep, we do.
Good.
Great.
Emily, regarding this important question, how do you say your last name?
I say it LaFlamme.
Laflemme. Okay, I don't want to mispronounce you unnecessarily.
Thanks for asking.
Yeah,
French
Stephanie.
Canadian?
Yes.
A lot of French Canadians in the middle, around Worcester.
Mm-hmm.
Yeah, they went to work in the factories.
Yep. First from Nantucket.
Do you speak French? No.
No, I mean I took it in high school and stuff, but I've been learning Spanish lately, actually.
That's good.
Yeah, muy bien.
Yeah, so Stephanie had sent me an update, which I will forward to you tomorrow on the market. We're also planning, John, you would be aware of this, for Overdose Awareness Month or Recovery Month,
Right.
planning a panel discussion, and it's going to be online on a Saturday evening, I believe. Is it Saturday or
I
Sunday?
think it's Sunday afternoon.
Sunday evening.
Yeah,
So
4 to 6.
yeah, and it's a really great agenda, because we'll have a keynote speaker, then we'll have the panel discussion, and the panel discussion will consist of people who have been touched by substance use disorder, both as someone in recovery, a parent, social work side of it, the policing side of it. So it's going to be a really, really great evening to have people see and understand that there are many facets to this, and more than anything else, focus on it is a disease. So I'm really looking forward to it. Of course, the market was again
All right.
today.
I don't think you were at our last coalition meeting, but I've really been trying to stress that most of the people who are attending are not actually going to be someone who needs services themselves. So to really focus on encouraging people who you know have an issue to get help, and what you can do, and what you can do as a good neighbor or a family member, so that there's more focus on, there's some focus on action that you can take as an individual, rather than just, I mean, part of it is just good education, but
Mhm.
I think that we see too many cases where everybody knows sort of that this person's in trouble, but nobody does anything.
Absolutely.
Larry, um, maybe you can help. I understand that there's been approval for some dispensaries in Watertown, and what would our role be if that's happening already?
We have none unless they create public nuisances. My comment to them is that odor is a nuisance and they must address odor nuisances. They have to address the security of their trash receptacles. But that is as far as we can go, because the way the Marijuana Commission has written their rules, they have essentially sidelined everyone out of the process.
So who's oversight? Who's got the oversight?
It goes to the Planning Commission and the Building Department.
Larry, I want to go back to the original comment that John made, and John and Rich, I don't know if you got a certified letter from an individual who lives next door to a house on Orchard Street where there's apparently a rat infestation. It sounds like that's not the first complaint that we've had.
Okay, so I went out yesterday with Raj once you had given us the feedback on it. And this is something that they've been dealing with for a while. So we have addressed the concerns we can. Right now, it is with the zoning department who needs to address all the overgrowth and harborage conditions. So we're working with them to get those issues resolved. The treatment is in place. The person who sent in the complaint is a pest control company representative. So he has knowledge, but it is something that we've been dealing with for a while now. Plus, there's also some other psychosocial issues at play. So it is not as easy a solution as it is presented. So it is a interdepartmental approach to resolving the issue.
Okay. Yeah, it was interesting. I saw a picture on Google of what the house looks like now, and it's very overgrown. But then on Zillow, there was a picture of the house like 5 years ago, and it's really changed a lot in 5 years.
It has, and you know, I know the zoning department is working with them. What they really need is a landscaper to come in and do some cleaning and all of that. And then, because it's a beautiful home, it's a home with slate roofs and it's an old Victorian.
Yeah,
it's really lovely.
On a big lot.
Mm-hmm.
So is this house is the complainant from that house, or is that a neighbor?
A neighbor.
Neighbor.
Because they're being affected by rats now.
Yeah. And that is something we're dealing with up on Templeton Parkway. We've been dealing with some issues in your neighborhood, Rich. We've dealt with some of that on the other side of town. I was out last week with Raj as well because he wanted me to see one. And then there was this lady who was complaining about the neighbor. And once we told them what they needed to do, he took action on his property. But then we're working with an abutting property that has overgrowth. And that is a big challenge. You have people with overgrowth, plus some people are planting their gardens. They're not harvesting the crops that they're growing. So it becomes food for rats now. People are feeding birds and it's becoming food for rats.
What about the, I know Larry, you sent me some materials for the biolab regulation. Anything, when do we need to move on that, and what kind of time frame are we on that?
Right. So it's one of the things I must apologize that I had planned to get to next month. But did I send you the list of the people who had submitted?
Yeah, I must say I forgot to look at it.
Okay, so I'm going to reach out to them and have an initial discussion with them to check their, to see if they still wish to serve on the committee, and get Mr. Driscoll also to nominate the fireperson. Name is with him, so he just has to submit it to us. And then next month, I would say we can interview them and appoint.
Okay. And then I need to talk with you about who should be the board's representative.
Mm-hmm.
But let me just check with the three of you or two of you that make sure that you really, if either of you want to do it, we certainly would consider that.
I would respectfully decline.
Okay.
Yeah, it's out of my wheel. I don't want to do, weigh in on things that are beyond me.
I mean, it really should be someone with more knowledge than Barbara. You probably come pretty close, but I don't know. You've got a lot on your plate.
Yeah, I've got a lot on my plate. And although my doctorate's in molecular biology and microbiology, I haven't really worked in that. I've worked in toxicology for 30 years, so
Yeah.
it's very dated.
Yeah. Okay.
Just so you know, John, it does not have to be a board member.
Right. I was just giving them the option. I didn't want to.
Appreciate it. Yes.
Yes, thank you.
And so we can talk about it, John.
Yeah.
Just so you're aware, I sent out something to you on the country club.
Yes.
Their tobacco permit had lapsed.
Yes.
It's in its second year, and they just sending something asking for forgiveness because the person who was supposed to renew it had some family challenges. But remember, this notice went out in November. It was in October of 2018.
So how come we allowed them? How come since they didn't renew
Remember, they were
here, how come they're not licensed?
they were closed. Remember, because they were under construction.
Ah.
And I know that we may have had inspection there and didn't say anything with it. But the thing is, if we go into a facility and we miss something, that doesn't mean it's right.
Yes.
It means we missed it. the duty to renew your permit is incumbent on you,
Right.
not the department. If the department didn't shut you down or tell you can't serve tobacco, then that doesn't mean that it was okay to do that.
Right. And, you know, this is an organization that it'd be one thing if they were a convenience store, but this is who is in no way going to let their license lapse. But this is an organization that is close to, here's a athletic sports venue, it's a golf course, but should they really even, I mean, I don't know that they're exactly the place you want to buy cigarettes from. They can't allow cigarettes in there to be smoked where they
The
are.
building, exactly.
And, you know, it's not like they missed the day by a month.
Right.
They missed it by 2 years, just about.
And it
Correct.
seems to me it's more
So
of a.
just so the board remembers that if the department doesn't renew the license, that license can never be renewed
Right.
So what I'd like to
or
ask
never
you
reinstated.
is not to discuss this any further, but give
Right.
it some thought, because they have appealed to me. I had some discussions with senior management, and I've been advised to get a legal opinion from our town attorney, and then give, in all fairness, if they're appealing to us, then I think the board should give them an opportunity to be heard
Right.
at your next meeting, and then you make your decision then.
I agree. Larry, this is definitely not a decision you take on yourself. This is a board decision.
Absolutely.
And we'll have the opinion of the town attorney before that meeting.
Yes, we will,
Okay.
because he's very responsive to anything we ask him to do.
Well, Larry, you had laid out some of the history when you message to us, but I think maybe before we to the board, we get as much detail on the appeal as possible.
Absolutely, it will be. We will put together a full packet for you, including the town attorney's response, a copy of the tobacco regulation, highlighting the process with renewal of permits. And as Dr. Strauss just said, failure to renew means that that tobacco permit is gone forever, because our tobacco permits, when they're lost, the numbers are being cut back. Because
We remember that from,
Yeah.
we chewed on that for a long time.
So, and Larry, I guess that was before your time, and we have never had this situation before, and I think it would set a precedent. So we have to think about precedents. Again, this is not the place to have a discussion, but
right.
think about precedents, because this is the first time this has happened, and how we decide will influence the future.
Exactly. All right, so I think that is what I have for you this evening.
Oh, one last thing on that is that I'm not sure we can guide them, but if someone from the board or someone really high up in the organization doesn't come and represent them, that's going to be telling.
Well, yeah, and I'm gonna send a formal notice to them
Right.
that the board, I have heard you, I've referred it to the board, and the board has instructed me to advise you that they will hear your appeal at their next meeting, which is scheduled for whatever the third Wednesday in September is.
Again, I think we should not discuss this anymore as we are officially being recorded. And it's not an item on our agenda.
Yeah, and it's just something I raised with you because I provided you with the information. So in thinking about it, it's just for you to have an understanding that this is coming to you because I've gotten it. And thank you for the background on the historical perspective on what you had done as a board when you made this decision.
Yes. Any other issues?
I think
So the next meeting would be the 3rd.
it's the 9th.
September 16th.
Oh, sorry, I'm on the wrong month.
Barbara, you started traveling again? I hope not.
No, I have some depositions and hearings coming up, and it's all going to be by Zoom.
Yeah.
In fact, my company has a travel ban on work-related travel through the end of this year. And all our offices are remote until the end of this year, and then we revisit it.
And I had to ask, so the date is the 19th. I'm sorry, just had it here. September 16th.
Oh, September 16th, yes.
And did your clothing fit?
So the 16th fits for me.
It works for me.
Yeah.
Yep, that's good for me. I'm putting it in right now.
John, are you local?
Not yet. Going to be local at the end of the month.
Okay, when you come back into town, I have your hat for you because you have a coat, correct?
Yes, I believe so.
Right. And the other two members got theirs this week.
Yes.
Personal delivery. Very impressed.
Oh, Larry, one other item I forgot. We had the email we got from Tony Palumba. Are we still having trouble with town employees being out and about without masks on?
No, that was addressed.
Great.
And the essential thing is that heads of department, he should have contacted the town manager on it and have him deal with it as against putting me in the middle of it. It's
Right.
challenging to deal with your own peers and in their departments. So, but it was addressed. I spoke to a couple of people and it was addressed.
Okay, well, I directed Tony to the manager. I said,
Yeah.
This is a employment policy and not a health department.
Right. And there are other things like recently I had to forward a message and have a discussion with someone else because one person called one of my staff members asking them to respond to them directly on something instead of coming through me or through the town manager's office. And that is the procedure. So, but we're working through things.
Good. Thank you.
That's why I'm your health director. Deal with those issues.
Yeah. But I think there's a clear distinction between your role as a town citizen and your position as a town citizen and your role as an employee.
Yes. But as I said, that issue was dealt with, so.
Thank you. Okay, any other issue? Any other, can
I'm
we
good.
end the meeting?
No,
I thank you all for joining us tonight, and we'll see you in a month,
Okay, thanks.
and stay safe.
Thank you.
Thanks. And
Bye-bye.
thanks, Emily, for joining us.
Of course. Bye.